So now we're focusing on side bending, and we notice the top picture, so it shows us like the overall range of motion of around 40 degrees measured from the occiput to the shoulders. But then we kind of look at how the individual vertebrae contribute to that motion. So we have A is the atlanto-occipital joint, and again then the lower cervical spine. And here this picture is nice because it really focuses on the angle or the shape of the facet joints, and we know that the occipital condyles are convex and the superior facets of the atlas are concave. And so as we try to roll and side bend, in this case it's showing us to the right, so as we roll to right side bending, we get a slide in the opposite direction to the left. And we can see that the upper cervical spine, especially CO on C1, allows for quite a bit of side bending. That'll become important later. If we shift our attention now to the lower cervical spine, we can see that the facet joints are shown here, and we have an inferior slide on the right side to go right, and a superior slide on the left side to go left, to go to the right. And so if we notice again, if we start to think about it, well, we can't have a straight superior and inferior glide in the facet joints because the joint angles, the facet joints are angled at 45 degrees. So anytime we have a slide in a superior inferior direction, we also have a rotation. So essentially, if we slide inferior, we have to rotate to the same side. If we slide anterior, we also have to go upwards, so we have to rotate to the opposite side. So a side bending right would be accommodated with a rotation also to the right, because we're sliding inferior on the right facet and superior on the left facet, which would be associated with a right rotation, and vice versa for the opposite direction.